Hi everyone. Uh, I want to discuss something very important when it comes to the orthodontic treatment of the teeth. Now, we all know that orthodontics is a branch of dentistry that deals with the correction of malalignment of teeth, that deals with the correction of spaces, that deals with the correction of any discrepancies of teeth and jaws, right? So once the orthodontic treatment is done, we get alignment of teeth like this, which is your maximum intercuspation. So we are more bothered about the alignment of anteriors, we are more bothered about alignment of posteriors. And once we see this picture, we feel that the patient is doing excellent, the patient's treatment is over, and the job of orthodontist is done. Now let me say the job of orthodontist is really done. It's not that it is not done. The orthodontist has done the job well and made sure that the opposing teeth are in alignment, the opposing teeth are functioning well when it comes to the closure, and everything looks good. The aesthetics, the phonetics, and the occlusion is taken care by the orthodontist. But what is the job a dentist would have after the orthodontist finishes orthodontic treatment is what I want to discuss now. Now, this is what we see clinically. This is our observation, right? This is the picture by the eye, and this is not the picture by function. What is the picture by function is your articulating paper. The armamentarium that you have to use after the orthodontic treatment is finished by the orthodontist is your articulating paper, which is also known as an occlusal indicator. So you have to take an articulating paper and you have to again check the interferences in static. What do I mean? The patient has to close down, tap, 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 and you see whether you have any incline interferences that are existing in between the teeth. If there are incline interferences that are existing in between the teeth, then you have to eliminate them so that you don't have occlusal interferences in centric, which is also known as static. After that is done, you also have to check how is the guidance from the lower to upper. Now if I see that the guidance is missing here, then the posteriors are rubbing against each other, then it is known as a parafunction, which is not in the envelope of function. What is parafunction? Parafunction is something which is away from the function. Now it is grinding. The back teeth, the posterior teeth are grinding against each other because there is loss of guidance by the anterior teeth, and you have the posterior teeth where that would be setting in after a few months or after a few years of after the orthodontic treatment is finished. So now what you have to do is you check if there is anterior guidance or protrusive guidance which is missing. You have to recreate it in the form of a palatal composite, in the form of anything that suits the clinical situation. I would not say that only composites would fit in. I would not say that only veneers or crowns would fit in. That you have to take a call clinically and make sure that the treatment is done in the anteriors to develop a protrusive guidance. And once that is done, you see that the posteriors are lifting away from each other because of the anterior or protrusive guidance. You again have to keep an articulating paper in the posterior and ask the patient to move the jaw frontwards, move the jaw sidewards, and you see whether there are any lines on the inclines again of the posterior teeth. And if you feel that there are lines on the inclines in the posterior teeth, you take a burr and you have to do a selective grinding on the posteriors, which is in your eccentric motions or eccentric movements, and this is known as eccentric correction post orthodontics. So after orthodontic treatment is done, you have to do a centric correction of the incline interferences. You also see the eccentric guidance and eccentric interference check in all the movements, in forward and sideward movements. And once this correction is done, then the orthodontic treatment is completed, and after 1 year again recall the patient and see whether the occlusion is stable. If not, do one more round of selective grinding. Remember, selective grinding has to be minimal. you cannot keep on grinding the enamel away and expose the dentine. If you feel that there are large amount of interferences, there is a huge interference in the posterior area and the anterior guidance or protrusive guidance is missing on a larger scale, then you have to go for a restorative option after orthodontics. So when you plan a case, you have to plan in such a way that you tell the patient that it might not be only orthodontics, it might be a combination of orthodontics and grinding, it might be a combination of orthodontics and restoration as well. If this is very clear to the patient, then after orthodontics, it is very easy for you to tell the patient, let's go on with this treatment protocol. So it's always a multidisciplinary approach that you have to keep in mind and tell the patient that ortho is not the only solution. It is always accompanied by either selective grinding, which is minimal, or after ortho, if you still have a problem that is existing, then you have to go with a restorative option, either in the form of veneers, either in the form of direct composites, either in the form of partial bonded restorations. Again, a minimal solution post orthodontics. For this, you have to plan well. And how do you plan well? You have to do a diagnostic mounting in centric. Only then you will understand what is the problem that is existing, whether I should take this case for selective grinding, whether I should take this case for orthodontics, or whether I should take this case for restorative dentistry, or a combination of 1, 2 or 3 altogether. That's how diagnostic mounting helps us to decide the treatment planning, as well as to explain the patient that this is what is going to be done in your oral cavity, to make sure that there are no interferences and to make sure that the teeth are stable in the stomatognathic system, which will not lead to breakdown of the teeth, of the sockets, of the periodontium, of the masticatory muscles, and also of the TMJ. And this is known as centric stabilization. I hope this video helps you. Till I come back with one more interesting topic, all of you take care.